Welcome to today's session. Myself, Dr. Mariam. We'll explore today the topic gout with all of you and share some valuable points. So let's get started. Gout is most common inflammation disease caused by the deposition of monosodium urate crystals in joints following chronic hyperuricemia. Most commonly affecting the big toe joint, but it can affect other joints also, including knees, ankles, feet, hands, wrist, and elbows. So gout, it is a form of inflammatory arthritis which will cause pain and swelling in the joints. It happens when there is a buildup of uric acid in your body, and when your body has an extra uric acid, the sharp crystals can form in the joints, usually in the big toe. And the gout symptoms come and go, reoccur in episodes called flares or gout attacks. So this is what called as gout. Risk factors. So gout can affect anyone. So men are 3 times more likely to develop gout. So women usually don't experience gout until after menopause, and people with certain health conditions are more likely to develop gout, including overweight, that is obesity, congestive heart failure, diabetes, hypertension, blood cancer, glucose intolerance, and all. Kidney disease. It can be hereditary also. Hereditary like familial history, and if the patient is having a family history, those patient or individuals also at risk of getting a gout. And when the patient is eat a lot of animal proteins, drink alcohol, take diuretic medications, immunosuppressants, dyslipidemia. So these are the risk factors of getting diagnosed with a gout condition. What is the etiology? So, a buildup of excess uric acid in our body will cause the gout condition. So, our body naturally makes uric acid when it breaks down chemicals called purines found in the certain foods and drinks. So, our kidneys usually filter this uric acid out of our blood, and then it leaves our body when we urinate. So sometimes our body will make too much of uric acid, or our kidneys will not be able to remove it from our blood fast enough. So in this condition, when our body has high levels of uric acid, that is the hyperuricemia, uric acid crystals can build up and settle in our joints. This sharp crystals will clump together and cause sudden episodes of pain, swelling, and other symptoms. This is what happens in the. So this is how the gout condition is formed. This is the etiology of gout. This etiology we can differentiate into few other categories. First one is primary gout. In the primary gout, the causes can be because of the rare enzyme deficiencies, hypoxanthine, guanine, phosphoribosyl transferase deficiency, phosphoribosyl pyrophosphate synthetase superactivity, ribose 5-phosphate AMP deaminase deficiency. So because of these deficiencies, it can lead to the primary gout condition. Secondary gout condition we can characterize into two types: because of increased uric acid and because of decreased uric acid. Increased uric acid, under this you can say chronic hemolytic anemia because of that, secondary exfoliative psoriasis, Gaucher's disease, high purine diet, cytotoxic drugs, glucose 6-phosphate deficiency. So because of these there can be an increased uric acid, and decreased uric acid in the case of renal failure, alcohol, Down syndrome, myxedema, lead poisoning, beryllium poisoning, and medication. So these are the few things, etiology of decreased uric acid condition. These both are the increased and decreased uric acids these are the etiologies for the condition of secondary gout. Coming to the pathogenesis, the patient or those individuals who are at risk of getting diagnosed with the gout condition, for them we can see increased uric acid production or a decreased uric acid excretion. Because of this, there can be accumulation of uric acid in the body, and because of the accumulation of uric acid, there can be a formation of monosodium urate crystals. These crystals will get deposit in the joints, and activation of inflammatory cells can be seen in the joints. And because of the release of inflammatory mediators, inflammatory reactions can happen in the joints, and if not treated, this urate crystals will deposit in the kidney, leading to renal calculi or topage formation. So this is the pathogenesis of condition called gout. So, which food causes gout? So, eating or drinking food high in purines are more likely to lead to have a high uric acid levels in the body, which will cause gout, which includes sugary drinks and sweets, which can be like a standard table sugar is half fructose. For example, fruit sugar, which breaks down into uric acid, and any food or drink with high sugar content can trigger the gout. High fructose corn syrup. High fructose corn syrup is a concentrated form of fructose which can be seen in the packaged food products and processed snacks, and these contains a lot of high fructose corn syrup. Alcohol. Even though not all alcoholic drinks are high in purines, alcohol prevents our kidneys from eliminating uric acid, pulling it back into our body where it continues to accumulate. Organ meats. Organ meats will include liver, tripes, sweetbreads, brains, and kidneys. Game meats, specialties such as goose, veal, and venison all contain high level of purines. Certain seafood like herrings, scallops, mussels, codfish, tuna, trout, and haddock. And red meat like beef, lamb, pork, and bacon. Turkey, especially processed deli turkey, and the last one is gravy and meat sauces. So these are the food which can result to the condition of gout. Coming to the types of gout, so based on the types of gouts are divided on the based on few categories. First one is based on progression of disease. Asymptomatic hyperuricemia, so in this patient will not show any symptoms, and uric acid levels in the synovial fluid will increase, and patients are treated by the non pharmacological management like the lifestyle, where we can prescribe lifestyle changes. Acute gout, in this patient will not like in the acute gout condition, in this the uric acid crystals get deposited and cause inflammation and intense pain, and the pain will subside within 3 to 10 days, and it is triggered by stress, alcohol, drugs, and cold weather. Next is interval gout. In interval gout, in this stage, it is a stage between the attack of acute gout. In this stage, deposition of urate crystals occurs continuously. Coming to the chronic, it is a severe condition. There can be a permanent damage occurs in the joints and kidneys, and patient will develop tophi in the joints and fingers. Pseudo gout. In pseudo gout, the symptoms are similar to the gout, and crystals which are deposited in joints are calcium pyrophosphate. So this is the classification based on the disease of progression of disease. Based on the causes, we can divide into primary gout and secondary. In primary gout, it is not a consequence of acquired disorder, and in secondary gout, it is a consequence of the specific disorder and a specific use of drug. So it is the based on the causes, that is primary and a secondary type of gout. Clinical presentations. So gout attacks are very painful and can happen suddenly, often overnight. So you can see the clinical presentation as like in the joints of lower limb like big toe, ankles, knee. Intense pain and swelling and redness can be seen in these joints, and discoloration of red or redness, stiffness, swelling, pruritus, and severe itching, toffee, tenderness, or feeling like the joint is on fire, that warmth will be present, anorexia, change in mood. So these are the clinical presentations or clinical features of the condition gout. Diagnosis and test. So diagnosis, first important thing, medical history. Ask the patient history, medical history, whether previously he have diagnosed with this condition or any condition related to uric acid, and check his ask them for whether he is a diabetic patient or a hypertensive patient, and whether he have a family history of gout condition, etc. So everything you have to ask the medical history, about the and as well as the medication history, so whether he is under medication for any such conditions, and family history. Next one is X-ray. X-ray imaging techniques and ultrasound, MRI, CT scan, and in blood test, elevated ESR can be seen, WBC can be elevated ESR and WBC, and blood test is mainly advised to measure the uric acid in our blood, and synovial fluid exam, polarized light microscopy, and joint aspiration. So in joint aspiration, we will use a needle to remove a sample of fluid from the inside of the joint and give for examination. So these are the diagnostic techniques which we can do to diagnose the condition gout. Coming to the management, how we can manage the condition. So first we can manage the management can be in two types, acute and chronic attacks. Treating a gout is usually a combination of managing the symptoms during a flare and reducing how often the patient consume high purine food and drinks. So in the acute attack of gout, you can advise the patient for resting 1 to 3 days and topical ice application, and review medication lifestyle, and resolve pain with NSAIDs, colchicine, corticosteroids. So these can be advised. And in the chronic attack, you can advise the patient to for uricostatic agents, that is allopurinol, febuxostat, and uric agents like probenecid, sulfenpyrrozone, and uricolotic agents like rasburicase, PEG uricase. And you can also advise NSAIDs like to reduce pain and swelling during the gout attack, and colchicine to reduce inflammation and pain if it taken within 24 hours of a gout attack, and corticosteroids to reduce inflammation. So these are the things you can do to manage the condition like acute attack and chronic attack of the gout. And for acute attack, like as I've mentioned before, apply ice pack, and you can advise or prescribe these medications like cap, Indocap 25 mg, 1 to 2 TDS, drug of choice, or a tab Arfleur 100 mg TDS, or any other NSAID, and cap Omaze 20 mg OD to protect gastric mucosa. And if pain is not controlled, add tab Daphanolone 6 mg BD for 5 to 10 days. And local hydrocortisone injection can be given, and a tab colchicine 0.5 mg 2 stat, then 1 tab 2 hourly till pain reduced, then 1 OD. So these are the medications you can give during the acute attack. And what are the lifestyle changes you can advise? Avoid red meat, seafood, alcohol, especially beer, fructose, that is the canned drinks. Then you can prescribe tab Chusi 500 mg BD, that is vitamin C tablet, and reduce weight if the patient is obese. Drink plenty of water and to avoid dehydration. For prophylaxis, so if there is a frequent attacks, joint destruction, tophy, or neuropathy, in this case you can prescribe tab Xyloric 100 mg up to 1 TDS, or tab Febuxest 40 mg OD to BD. And if 24-hour excretion of if 24-hour excretion of uric acid is less than 800 mg, then you can advise or prescribe tab Benacid 500 mg BD. So these are the things you can do if there is a frequent attack, or if there is a joint destruction or a neuropathy cases. Coming to the complications, what are the complications of gout? Secondary infections, chronic renal failure, severe degenerative arthritis, uric acid nephropathy, nerve or spinal cord impairment, joint damage, joint deformity, loss of mobility, osteoporosis. So these are the complications of gout condition, and how we can prevent the condition. So the best way to prevent gout is to limit how often the patient consume high purine food and drink, and the patient can prevent by getting a good hydration, drink a plenty of water, and advise regular exercise, and also advise to take the medications prescribed if he is already under medications for diabetes, hypertension, or any other medical condition. The patient have to take as per their doctor advised, and and have a regular checkup every month or an alternative months about the patient's health condition. So this comes to the end of our topic, gout. Thank you.